public dollars. And throughout the process of considering Bridge Street Mission, there are numerous things that have come up, both within the community and people that care about the unhoused population. And so some things that I think are important. Bridge Street Mission is a faith-based organization. I don't think that's a secret to anyone. There's really 4 legs to their organization. One is their Men's Recovery Center. That is a faith-based curriculum that provides housing. It's on the 2nd floor of their facility. They're completing construction on their Women's Recovery Center, which will also follow a faith-based curriculum to recovery and AODA treatment and mental health treatment. Those have restrictions and an agreement, as I understand it, for those people participating to participate in the faith-based curriculum. They also provide day shelter services, and they're building out that space, which has the ability to serve up to 120 people per day. And that is no restrictions, no need to participate in faith-based anything, a completely non-discriminatory admittance process. None of those 3 things are being funded by the city in this contract. What this contract is for a new service, the 4th leg, which is their emergency shelter services. And they have space to build out 8,200 square feet. I think from a context perspective, at the CPC, where Catholic Charities was providing that service, they were able to serve 30 people, and they had approximately 3,000 square feet. So this is more than double that amount of space, and it would all be built out brand new, architecturally designed to serve as a shelter. And so the concerns about, well, who will be served? In this contract, the city attorney, Ann, and I worked to ensure we have language in there, which is totally agreed to by Bridge Street Mission, that there's no discrimination on the providing of those services to anyone in the emergency shelter service. So the other thing that's important that I think spread like wildfire through the unhoused population, which was a significant concern of theirs, is the belief that they would be drug tested or alcohol tested in order to be able to receive services there. And as I mentioned at the last finance meeting, that is false. There's nothing even remotely true about that. As a matter of fact, in their proposal, in the design that I've had the ability to review, it has separate spaces for individuals whose level of intoxication, lifestyle concerns, mental health, whatever it is at that moment, if it's not conducive for them to be able to sleep in a communal environment, they have separate spaces for those individuals built into their plan. So all of the things that were important to us to have in a shelter were included in that proposal. The other thing that I recognize that there's individuals whose ideology or their beliefs might not be consistent with Bridge Street Missions, but one thing I think everyone agrees on, or everyone I've talked to, is Bridge Street Mission does a very good job at delivering that service. You have Craig Vincent, who's their executive director. He's got 30 plus years of experience in providing shelter and recovery services. They do an outstanding job of partnering with the community, which is illustrated by their ability to do everything that they have right now in a new facility that's being rebuilt without asking for public dollars. And so they are able to fundraise within the community. And the reason they're able to do that is because they're doing good things and they're moving the needle. So my concern at this point, and a component of my recommendation to please enter into a contract, is there is no other option. There was no one to compare this to. There's no one that's non-faith-based to be able to say, well, what about them? We received one proposal, and they're capable of doing that job. So for me, I don't enjoy the luxury of considering ideology or faith or anything else. My responsibility is to keep our unhoused population as safe as possible. I think a key component of that is that we have access to shelter in this community to maintain the quality of life. That's my job as the chief of police. So I don't have that luxury. What I need to see is how do we keep them safe? And we only have one option. They're capable of doing it. And so it's really a question of, do we want shelter? Is it important for us to have shelter for the unhoused population in Wausau? Because if not for this contract, we're not going to. We're not going to have 365 shelter, and on December 31st, we're going to have approximately 30 people, because keep in mind, Catholic Charities is going to reopen. They have a capacity of 30. We're serving upper 50s. Those of you that came to the shelter saw a busy night on that night. So half of those people are going to be out on the street, and I don't want to see that in Wausau. I don't think that's a net benefit to us. And lastly, I'll just talk about the cost, which is not insignificant. But in my education and being responsible for a shelter, I know what we're spending right now, and we're spending more than Bridge Street Mission plans on charging us for their first year. Our burn rate is about $30,000 a month, and times 12 is $360,000, and they're asking for $350,000 in their first year. So I don't find their financial requirements on behalf of the city to be unreasonable. And lastly, I would say this year in the shelter services that we're providing, I think everyone's aware that it is a partnership. It's the WMC shelter, the Wausau Marathon County shelter, because Marathon County is funding 50% of the cost for us to provide shelter services. I can't tell you that the county is going to financially partner with us. I think the argument that I plan on making to them in the ask, and I know their Health and Human Services and Lance Leonard, the county administrator who I've been working with, will be bringing it up to them, but that comes up in their budget process. And so they run a similar timeline that the city does. So we don't know the answer to that yet, but there was an overwhelming support the first time we asked them for money for 2025 when they allocated $200,000. And one of the key reasons for, I believe, that support was that people from all over Marathon County and other jurisdictions are coming to our shelter and utilizing those services when they enter homelessness. And the idea that Wausau residents were historically, up to that point in time, subsidizing those other communities who have a need to take an unhoused individual in their community and put them somewhere safe, they were bringing them to Wausau, and the Wausau residents were paying for that with their ARPA dollars. So that was recognized, that was discussed with the county board. That'll be the same conversation. What was important to them is that numerous county board members or supervisors indicated that they have no desire long-term to be funders of shelter services in Wausau, and requested that any proposals and in the RFP that we ask for a plan to become self-sufficient, which we did, and that's illustrated here. I also think it's reasonable with the challenges. I've learned a lot in a very short period of time with shelter. I'm really glad there's someone in this community that we believe is capable of doing it, that is willing to provide that service. Thank you.
Thank you for those comments. I guess just a couple things that stood out to me. I think their ability, when I was reading this, first, I'm glad we included a copy of the contract, because it's a fairly simple contract. It's not a 300-page agreement, but it does codify the things that we want in terms of services and deliverables. I think their ability to scale up to accommodate either extreme cold, extreme heat, whatever that is, I think will ultimately relieve pressure on the Community On-Call program, which we know during the cold season this last winter, we had to use an awful lot during the month of February. So I think their ability to expand that capacity is huge for us. One thing I noticed when I toured the Bridge Street Mission facility, when they first acquired that building, I took a tour of that facility, and one thing that was important to them was dignity and what the facility looks like from the outside, where people wait for services, what the perception of that facility is, and the people who use it. And the fact that the same level of dignity in treating those guests and caring for people that are coming for services, that stood out to me. Because that's something that we also care about now that we've been operating the shelter, is that people are treated well, and that they're treated with respect, and that they feel like they're welcome, and that they're not treated like a number. And so I could detect right away from my tour of the facility and their vision for how that facility operates and how it does its work within the community and the image that it projects. I think that, there was definitely a commitment to treating everyone with dignity and respect and getting them the services they need. The fact that they're willing to run that night shelter separate from the other programs that are voluntary is also huge. And I think that really allays a lot of the concerns that I had heard early on from the community when misinformation started to bubble up. So I'm glad that you were able to debunk some of that for us.
Yeah, I think a couple of things that, as you were speaking, popped into my head that just to illustrate the foresight into how shelters impact a neighborhood. I'm well aware because I get the complaints, the concerns with our shelter in that the doors open at 6 and people start showing up early and then they're in the neighborhood and standing around there. And I think everyone's aware of the challenges that Catholic Charities had when their doors opened and the amount of people congregating at the CPC. The Bridge Street Mission built in an indoor waiting area for people. Their shelter's going to open at a particular time, but they don't want people out in the cold or out in the heat. They want them indoors, seated, so that's built into their facility. And I think it's also important just to mention that Craig Vincent is in a similar situation to me. You folks, for this to move forward, have to vote for this contract. He needs his board to vote for this contract, and they have a meeting, I believe, Tuesday next week to be able to do that.
We've come a long way. I think one of the things that we identified in our council retreat last year that we wanted to make an impact on as a group, and this was one of the areas that we all were able to find common ground right away, even with the new administration, was homelessness was one of the 3 things that we picked. And certain things move the needle, but this really moves the needle. The fact that we would have a solution that is a multi-year commitment that weans itself off of public funding is one way that we can really make that impact and make sure that we're not only assisting those guests and keeping that population safe because they are vulnerable, but making sure that those services exist in perpetuity and that, from one year to the next, we're not going to have this uncertainty about a place where people can be. I think that's big for us as well.
Yeah, Lance Leonard and I, who have received some direction to work on the strategic plan to address homelessness in Wausau out of our task force, have begun putting together the framework and what should a strategic plan like that look like. One thing that we're both very much aligned on is in order for any plan we have, one of the key components is that we have safe places for people to sleep in the form of shelter. And my concern is without a contract like this, I feel like we'd be behind the 8 ball when it comes to that. And then lastly, I just want to address some members of the community have reached out to me and said, well, why doesn't the police department just continue to provide this service like they're doing now at the church? And the fact of the matter is, number one, we're a police department, and I would like to spend more time focusing on police-related things. But more importantly is the fiscal component of that. That space has an emergency temporary use permit. It has 1 bathroom for 2 bathrooms and 1 shower for 60 people. And the fire department gave us conditional use as well as the inspections department. So the amount of money that would have to be spent in that facility in order for it to even be considered appropriate as a long-term shelter facility makes it unreasonable to do. And then to try and find 10,000 square feet that meets the expectations for habitation and shelter, I don't know where that exists in Wausau right now. And if it did exist and it were privately owned, I don't know what the price tag would be, but I'm certain it would be 3 to 4 times what we're paying right now at the Methodist Church. So
It's a heavy lift, and it would be a heavy lift for us to continue to manage it. I don't think Tracy can afford to continue to work 15-hour days for years to come. So,
yeah, I'd invite you if you like that. You guys all know that Tracy's doing the heavy lifting. I think she has the respect of this council, the county board, as well as the unhoused population and everyone associated with it. If you'd like to hear what she has to say, I'd encourage you to invite her up.
yep, we certainly should do that. Also, we were there. For the council members that were there that served that Monday night, we did everything from the intake to the meal service to the cleanup to the check-in, all of it. And, she was right there helping us do that. And, we sat and had conversations with the guests. And, they could not have been more gracious and more friendly, and they offered us some constructive input and some ideas for things they would like to see. And, I just think that that experience was so valuable for us to have that. In fact, I've had a number of council members request the opportunity be offered more than once. So, obviously that experience made an impact. And, I think for those of us that were there, all of us, in fact, I even asked that you make the same offer to the county board. Based on their size, they may need to split it over a number of nights, but I would say that that is an experience that is really, really positive, and you get a totally different understanding of what it takes to do the work and why that work is costing so much for us. I mean, for us to spend, $30,000 a month in perpetuity, that's an awful lot of money. And, and it's a huge future drain on our budget, where if we can come up with a plan that weans off, that's a big deal. I guess, committee members, any questions for the chief before we would bring up Tracy? Alder Lukens.
Sorry. I guess I have a number of concerns, maybe more than questions, so I don't know if you want me to bring those up right now.
Go ahead.
So I have had, let me back up. So when I volunteered, I had a wonderful experience, and I have been supportive of all of this. But I have to say that I've had quite a number of people reach out to me, including people that have been in prominent roles, leadership roles in this community. And every single person that I've talked with has spoken of the good work that Bridge Street Mission is doing, the person of integrity that Mr. Vincent is. So it's not about that. But I've also been in contact with some of the county supervisor with the Human Services Committee. And so one of my questions, or one of my concerns, is that right now we don't have a guarantee from the county. It's only guaranteed that they will fund or help fund through the end of this year, correct?
That's correct.
Yeah. So, I'm just going to say, what I would like at this point is, because of the many, many concerns that have been brought up to me, I would like to postpone this. And I understand that they're waiting, or they need to know, that Mr. Vincent needs to know. But one of the big concerns that I've heard is, yes, of course, the staff, the volunteers, that they have to ascribe to Bridge Street Mission's, and sorry, I thought their doctrinal statement. And I understand that. I know that a lot of places that provide shelter, are religious organizations. I also understand that, that the intent is there's not going to be any discrimination. But the thing is, I think I'd like to bring up another perspective that I'm not sure has been considered, and that is people that have suffered abuse in the name of religion, and there have been whole ethnicities that have been oppressed in the name of religion, and some of those communities from those ethnicities, still struggle with a lot of addiction and things like that. So maybe some of the people that are unhoused, I don't know. But the fact is that, it may not be, it's not about Bridge Street Mission's work or Mr. Vincent's work. Everyone has good intentions, but if they're going to avoid going somewhere like that because of that, I don't know if that's been considered.
Yeah, I mean, if you wouldn't mind, I'll address my thoughts on that. Like, those same concerns, for lack of a better deal, same church, different pew, on issues like that existed but the police department's going to run a shelter. And what percentage of the unhoused population has had a negative impact or a negative experience with law enforcement? And they come. And I would say I have met many members of the board at Bridge Street Mission. I've spent countless hours, as well as Tracy, because Mr. Vincent participates in all the community groups and organizations in our task force, and I have never met a kinder, more compassionate group of people. And I would ask those individuals that have those concerns, is it better to open a shelter with an overflow capacity of 75 to serve the unhoused population of Wausau, or to not? Because it would be a valid discussion and conversation in my mind, and something I would want to consider if we had more than one proposal. If we had two groups, and one were Bridge Street Mission and one had a different ideology or philosophy on how to deliver services or who they should hire, but we don't. So at this moment, we are at the 11th hour to be able to get this to happen, because there's a concrete 8,200 square foot room, and the individuals who are working to fund that, they need to see a contract from our city with Bridge Street Mission in order for those dollars to become available to secure contractors to be able to do that work. And I am very concerned that we are going to run out of time. So I think, as much as I can appreciate your concerns, I don't think they're invalid. I see them as wants, and what we need right now is shelter, because the alternative is they're sleeping outside. And that's not acceptable to me. I know what that looks like when we don't have enough shelter in this community, and the challenges from maintaining the quality of life in our community and our downtown, and the challenges to law enforcement. And so without more than one proposal or another entity in Wausau that can provide that service, I see that as a want, not a need. And that sounds callous, but I'm about keeping people safe and having them have a place to be. And maybe you guys think I'm overly simplified, but that's what it is for me right now. We have someone that can provide the service, and no one else is stepping up to the plate to do that. No non-denominational group, no one else has the capacity or the desire to do this that has stepped forward. So we have a choice. Do we want shelter or do we not? And I struggle with postponing that decision any farther.
Well, another question, thank you for that. Another question that I have is, would it be possible for, my understanding is that at the end of Q1 of 2026, there's supposed to be a report that may outline this county-city coordination of this, is that correct?
That is the deadline for the county and the city to collaborate to draft a strategic plan to address or end homelessness in Wausau Marathon County moving forward, similar to La Crosse's Pathways Home program. Like, it would be very nice if we could just take theirs and say, wouldn't that work here? But we're different communities with different challenges and resources. So that is what I spoke to about the framework of what we're putting together. A component of that is going to be emergency shelter. It has to be. But other components of that are likely to be things that between the county government and the city government, we have some control over, like transportation, like mental health care, like AODA treatment, like economic development and addressing housing shortages and how that impacts the unhoused population. So those are things that we have direct impact over. And the beauty is, with this plan moving forward, although it's 5 years out, it's not going to be a city responsibility or a county responsibility, because our responsibilities are the things that we're funding. And so to be able to remove one thing from that, to be able to more positively address those other issues, I think this is just one of the challenges. There's lots of other things that when this can get done, then we can start looking at those other issues and bringing those forward and finding creative, affordable solutions to those.
Thank you. I guess, and I'll try to make the rest of these really quick. I think another concern of mine, so there's this 8,200 feet, right? The Methodist Church right now is what, about 10,000?
Correct.
So that's going to be smaller as
Yes.
far as emergency shelter. I guess I have a number of concerns about it, and I guess my wish is that if we could extend for 3 more months, that Methodist Church, that area, to give a little bit more time to see if there is, I guess I'm just really uncomfortable with the number of people that have reached out to me, that for me, myself, I can't vote for 5 years. I cannot approve 5 years, me, myself, because I appreciate everything you've done, but the number of people in this community that have reached out to me, and not just with, rumors that have gone around, but the number of people that have reached out, I have too many questions that I guess, that are unanswered. And the trauma aspect really does concern me with religion. I understand, but it is valid. I know that firsthand, and I have worked with many, many students from marginalized communities who will not even ride a city bus with students from a traditional school because of trauma. So I do think that's real, and I guess that is a concern. So I know it's last minute I'm bringing this up, but this has been brought up to me, and there are concerns I have. So thank you.
Okay. I share your concern about time. Knowing what it takes to get construction and permits off the ground, we have a finite supply of money and zoning and conditional uses. And I think that if we defer this action for too long, we are going to miss our opportunity. The other problem we have is that the 2026 budget process begins now. Finance will be starting their work, and the CIP committee will be starting their work in a matter of weeks. So the idea that the 2026 budget, this action really basically creates an earmark in that budget for this service as a commitment into next year's budget. We're funded for this year. I do think, and I will say, I've heard some similar concerns to what Alder Lukens has. Mine has not come from an overwhelming supply of people. It's come from 3 individuals, none of whom live in District 7. None. The feedback that I've received from folks who live in District 7 are, first, thank God you're providing shelter right now, and will you have a qualified nonprofit agency to hand this off to at the end of the year? And what is the plan that we don't fund this off the levy long term? And so the plan that's before us really checks all of those boxes. People are getting served now. They're not going to be in that situation forever, and our taxpayers are not going to be in that situation forever. And so that made this much easier for me to support. As soon as I was able to tell my residents that these things are separate, the participatory voluntary programs that are offered by the mission are completely separate from emergency shelter, and we are focused on emergency shelter. The fact that there's a silo around that satisfied the folks that I've talked to. So I don't have those same concerns, and I do feel like we should act on it tonight because there are a number of downstream decisions that have to be made. And if you ask someone to start construction and finish construction before we run out of time and money, we cannot afford to sit on that decision for a month or two. We cannot. It's not fair to the people who have to do the build out. And the fact that we've been through 2 complete RFPs and no one else in the private sector has brought another plan. I heard similar faith-based concerns about Catholic Charities from people who had differences of opinion with their values. So, we have church groups that are volunteering on a monthly basis in our shelter. And regardless of what their beliefs are or their ideology are people. We need volunteers, and we have guests who need services, and we need to find the best way to provide that. And if this plan does that job, that's the work that we're tasked with. So, that really is what I've heard from people when I've been out in the community having those conversations. Are there concerns? Sure, there's concerns. But you've addressed those concerns in the contract by restricting discrimination or by restricting anyone's ability to compel shelter guests to join the next phases of the treatment programs. If someone is offered services that are given at the mission and their answer is no, no means no. that conversation ends. So,
Well,
there's
no,
other resources in the community that they could be directed to through navigators.
Allow me to interject for just a second, because no means no, I don't want to participate in
Right.
your rehabilitation center.
Right.
They still have case management and navigators that then find where are the resources in the community that can help you.
Right.
That
If
is
it's
part
not
of
this,
their.
then what?
That
Yeah.
is part of their proposal, and I don't want anyone to be confused. The desire for them to have a non-discriminatory admission process was not something we had to ask them for. That was in their proposal, and I would just mention that I think if we went to shelter tonight and sat down with each individual person, we would find out that every single one of them have dealt with trauma in their life. I don't know how you are experiencing that lifestyle for any period of time, either what got you into that lifestyle or as part of that lifestyle. And in order to provide services to them, you have to just be a compassionate person and understand that and be trauma informed. So I don't share the concerns that those constituents called you with. And I base that on my own eyes, ears, heart, and working with Bridge Street Mission over the last several years. They're a great organization doing great things, and the alternative is untenable. And to your point, from a timeline standpoint, I wish we could pump the brakes and address everybody's concerns. If this council doesn't move forward, we are not going to have shelter. We can't push it back 3 months. I would not expect Bridge Street Mission to be patient enough to give the council 3 months to wait and see how this looks. This is kind of a now or never deal. And that's not me trying to put pressure on you. You guys are the policymakers that have to make the decision. But I also know if yes, here's what it looks like. And if no, here's what it looks like. And if it's no, you have people sleeping outside this winter.
It's going to be a hard winter.
I think Alder Tierney's got a question.
Thank you.
And then Alder Watson.
My opinion is we've got to move forward. First of all, First Methodist Church is not possibly going to give us 3 more months. This was supposed to be a temporary situation with them, and we wanted that through the 31st, and they've given us that. As far as the volunteers, when Mr. Vincent came up here, are not made to have the same religious ideations as Bridge Street. They said there's volunteers in the upper tiers of their organization that do, but the people that are coming in to volunteer, to work in the homeless shelter, to provide dinners, to check them in, can be anybody. There's rumors out in the community that just aren't true. And my fear is if we don't do this, we're going to have deaths from people that are at Marathon Park that freeze to death. There's no good situation by not doing this. When Catholic Charities is closed to additional guests, there is no place to go without Bridge Street Mission. The only people that step up to do these kinds of projects are faith-based facilities like Catholic Charities, like Bridge Street. And there's a lot of people saying, don't do this, this is just not where our tax money should go. Find us another place. You tell us where to go, because there is no other place. They have given us this opportunity, and if we say no, there is no second place to go. It's what we have to do. We have to give these people shelter. We have to give them a safe place to sleep. They're getting fed. They're given the opportunity to take showers. And like I said, nobody else is stepping up to the plate. So I don't see how we can say no to this. And I will be supporting this tonight. Thank
Take a
you.
comment from Alder Watson and then Alder Larson, if,
So, I guess sort of along with Carol's issue, with one of the things is I really wish this was a contract entered into by the city of Wausau and Marathon County, right? Instead
I do
of our
too.
just name on the top. Also, we have that 5-year plan for the money, so I'm assuming this will come out of our budget during budget times? That's where because our ARPA funds are dried up, right?
Right. So I can't magic 8-ball or crystal ball what this looks like in the future. My hope is that there are grant opportunities that we can use to offset some of this, and my hope, and what are hopes worth, right? But I'm going to be optimistic until I have reason not to, that the county will recognize the value in this and prioritize this in their budget to continue to be our partner with that.
Okay. And so there's not, I guess I was sort of confused because I thought after that, this whole shelter idea, this whole RFP stuff was all like sort of a team process, with Marathon County and us. It's not just going to be us.
Yeah, and I think that it was, and I worked with the county administrator because the hope was in the first RFP, we would have someone that the county and the city were funding and in delivering those services in the proposal, except we didn't get a response in the first one. And so what the county had allocated was $200,000, up to $200,000 for 2025, with it being a match of the money that the city spent. So every month we create an invoice with an itemized invoice of all the money that's spent on the shelter for wages and rent and everything else associated with it. And then we divide by 2 and they get a copy of it and as an invoice. They will not spend $200,000 this year on shelter services. So my belief is there's a desire for the county administrator to ask the county board to take, it's an easier ask to say, here's money we have left over from 2025 that we can allocate to 2026, and then the ask is lower. And honestly, it's not going to be a $200,000 ask if the cost for this by contract is $350,000 in year one.
And then one last question about the date. It said completed before June 1st of 2026 is the construction, right? When are they going to actually open the doors? Because it said something like effective upon the date first above written. And the only date I can see first above written was July 9th.
Yeah, so the challenge, the one thing left to do in that contract to be settled with the city attorney and myself, and a final copy of it is when that start date would be, and the start date is based on how quickly can they get their space constructed. They can't start the construction until they get that separate source of funding that is willing, as I understand it, they're confident they can get, but nobody's going to give them money to build out something that they don't have the operational agreement to do. So it's kind of a chicken and egg. Like, really, the egg is we need to make a decision here, enter into an agreement with them. That triggers their ability to receive funding to do the construction. The sooner they can get that construction started, the sooner they can open. And that's why the postponement of different components of this pushes it off exponentially into next year. What the contract allows us to do is if they can't get that built out by June of next year, we have the ability to exit the contract if we want.
So what's going to happen if they don't get it built out by the end of December?
Yet the likelihood that it's built by the end of December is very low. I'm going to have to get creative. I mean, we will have some funding available to be able to, likelihood is to maintain what we're doing, knowing that the exit date of that, and I'll have to work with the fire department and inspections and
And the church.
yeah. So
Yes.
I think everyone involved in that wants the right thing and to be able to provide a continuity of shelter. But right now I have permission to go through December 31st based on those entities and our conditional use.
Okay. We'll take a question from Alder Larson, and I want to leave time before we adjourn here for comments from Tracy Durante also, since she's been running our operation. Go ahead, Lou.
Thank you, Madam Chair. I just wanted to say, it's sad that in some people's eyes that, this contractor doesn't check all the boxes, so to speak. People are, but when you get right down to it, there isn't anything else. Nobody else has brought anything to the table. And, I've been on a public health and safety committee the tenure I have been, I heard people say, well, we need 5 more Tracys, to do this. Well, if an unhoused person were to get a seed in their head, from participating in this shelter, to this place has the the resources and the ability to help people get on their feet, get jobs, get home housing, and it's not at the city's expense.
Right.
You know, so I'm going to have to support this. I'm not going to have to support this. I am going to support this because I think it says the contract is automatically renewed year after year, but I'd like to just see it go for a year and then, but I just see it as a win-win situation for the city. And if there's things that come up where religion or whatever were to get in the way, well, we can address that as we go along. But so long as they keep their spirituality part to their programs and keep the shelter separate and operate as such, I really don't see a problem, and I will be supporting this. Thank you.
Okay.
Yeah, just real quick, one of the things that was important to the county, should they become financial partners with us, and I felt was also important to protect the interests of the city, is to draft a contract in such a way that truly expresses the commitment on behalf of the city to participate in this contract through the duration of the contract. But I don't know whether we have a natural disaster or one of the really bad things happens, or what happens financially for the city. So it leaves the city the opportunity, if it's unaffordable to continue, it gives the city the ability to have an out of that contract. And I don't think that's desire of anybody to not fulfill the contract, but I also wanted to put those protections in place.
Yes.
Alder Lukens, I have another comment.
Go ahead.
Thank you. I did. So regarding the volunteers, it states right on the website that volunteers must share Christian faith and agree to doctrinal statement. So
Yeah, but they don't have an emergency shelter right now. That is for the other legs of the stool
Okay.
that currently exist there.
Okay. But the other thing is then, is there a way I'm uncomfortable with 5 years. And from people, again, that I did hear from a lot of people. I was surprised at the number of people that I've heard from since the last meeting. So is there a way, what if the numbers that have been attending, what if that drops with this? Is there some way, because I don't see any metrics there, so unless I'm missing it. So is there some way to put some type of protection in there so that if it does happen, that they are experiencing less because of that there is something we can do? And is there a 1 year that it doesn't automatically renew? I would be more comfortable with that.
I mean, I can give you my opinions based on my meetings with Bridge Street Mission to be able to come up with this contract. I mean, the short answer is no. They produced, and it makes sense to me, they're saying in order for us to achieve financial stability that doesn't require levy dollars or public contributions, this is our pathway to do that we're comfortable with, that we believe we will be successful. And so I don't anticipate they would be comfortable with a smaller contract unless it's the same amount of money and you just want to pay it in 3 years. But they're saying that's what we believe it's going to take. There is a requirement in the contract that I added that requires their attendance at Public Health and Safety to be asked questions about their operations or address any concerns at least 6 times, no more than 6 times per year at the request of the Chair of Public Health and Safety. And so any concerns that exist can be addressed. We do have our expectations in the contract, but a major concern of mine would be if instead of 60 people, there's only 30 people utilizing it. Their expenses you still need staff to be there. And I don't think a reduction in the number of people attending other than how much food they would be purchasing, I don't think we would see a significant reduction in cost. It's something that I'm not opposed to discussing with them. Like, what if you're not popular and nobody comes? What do we do then? I'm 100% confident that's not going to be the case, because I think they're going to have a great facility that meets the needs of that population. But I don't see a way contractually at this point with them with what they need in order to be successful, where that would be acceptable to them.
One thing we've done with other arrangements like this that are similar is we have scheduled cyclical annual review, where we bring in the participants and we take stock of the effort. I mean, we've done it with everything from certain enforcement programs to animal control. We bring in the folks that are involved in the arrangement, and we take stock of the effort and determine if adjustments are necessary or if we're succeeding. There is no reason that annual review could not take place in public health and safety well in advance of the start of the next budget year. If we have committed in the contract that we're willing to or expecting to meet with the provider roughly 6 times a year to take stock of their effort throughout the duration of the contract, we can also set a standing agenda item for September 1st of every year to do a official review of the success of that program and articulate any concerns that have come up during the year and anything that we need to see adjusted. There's no reason that we can't have a standing agenda item to take stock of those efforts. And that would be an open public discussion where, we review how many people have been served and, what results are we seeing? What benchmarks is the needle moving? Are we seeing an increase or a decrease in utilization? I think we found out from our volunteer night at the shelter that knowing that the population of our own shelter varies from 30 to 58 on a given day. I think we had 54 the night we were there. It was a very hot day. They do have to be fully staffed, whether they're getting 30, 40, or 58. So I agree with you on that. I do want to leave some time for remarks, though, from Tracy, who is up to her eyeballs in this work. And so I believe in terms of credibility, she is the person we need to hear from. She is in the community with her sleeves rolled up doing this work every single day in our shelter and in the streets. So the question that I would have for her is this the plan? Is this the right plan for this particular time? And, I guess she's had experience also. She continues to serve on the United Way's Housing Task Force along with the chief, the mayor, and I. And, we've seen an awful lot of things surrounding homelessness. So welcome, Tracy.
Thank you. Well, for starters, I just want to say thank you for caring about the homeless population. I've been doing this work for a number of years, as you know, and one of the things that's really important to me is advocating on behalf of what my clients tell me and the stories I hear and the traumas and all the other things that go along with that. I can tell you that Bridge Street Mission does do quality and great work, no doubt. And if they are chosen to be an option for a year-round shelter, great. I will look forward to being able to get back to my daily duties, and it has become a challenge for me to fully operate a shelter, which takes 40 hours all in itself, and to also continue to get people resources and get people housed. I often am working numerous hours to fulfill my job duties as an outreach coordinator, as well as the added responsibilities of the shelter director. So I fully respect this body, and whatever decisions that you make as a body, I will continue to do the work I do on behalf of the unhoused either way.
Okay.
Thank you. I think Alder Gisselman, you had something?
Well, thank you. The contract was delivered to us today. And I think that's one of the things I was embarrassed by the delivery of the contract so late into the discussion with regard to this proposal. And I think for at least for the Finance Committee, I would move to put on the table this agenda item to the next Finance Committee so that we certainly have enough time to review the contract. That contract was delivered sometime today. I did not see it until 4 o'clock this afternoon. I would like to bring it up. I would like to lay it on the table until our next Finance Committee in well, whenever that next finance committee is going
Next
to
one
be.
is July 22nd,
Right.
unless we hold a special finance meeting. So Alder Gilselman has made a motion in the finance committee to lay this on the table until the next meeting, so we have time to properly review the contract. Is there any discussion on that? We do need a second. Is there a second?
I'll second that.
Second from Alder McElhaney. Any discussion? I mean, the contract is pretty straightforward, I guess. There's not a whole lot of terms in this contract, so I know it came at a very late date, although we have talked about the concepts of this plan at our last finance meeting when we were discussing the request for proposal in the closed session. So nothing here in the contract seems out of the ordinary to me. I think we can move ahead on this.
Well, I think one of the key points that was made before was that in some of the documents from the police department, the partnership with Marathon County, and I'm not sure that this will be a part of further discussions, but, where is Marathon County in this contract? That's why I would like if it'd be a couple of weeks or whatever, to look at this contract and see what we can do. So that's why I moved to lay this on the table. Thank you.
All right. Any other discussion on this? There's a motion. This is
Finance only.
yeah. This is just as concerning finance. So there's been a motion that's been made and seconded by the finance committee to lay this item on the table until the next available time that the finance committee can meet, be it the regular meeting or a special meeting. All those in favor of laying this on the table, say aye. Okay. Those no?
No.
No. Motion is defeated 2-3. So,
You can take a motion on the original contract
Yeah.
if you want, or we can.
if there's no other discussion from finance, we can take a motion on the original, moving the original contract forward. I do have one item. I guess we haven't really talked about the financial aspects of this because it would be $350,000 for 2026, and I don't know, Marianne, do we have a funding source identified yet, or any ideas on how we would move this forward on a financial point? Or?
It would have to be levy funded unless, as Matt pointed out, or the chief pointed out, he can find grants to help defray some of those costs. And if there would be, right, the partnership with the county, and then as well, if you did have ARPA funds available left, you could look at that too.
Okay.
That would be an option if it was
So
still available.
So if we were to move this forward, this item would become part of our 2026 budget.
So in my mind, you don't need a budget modification today because you're not spending the money until 26.
No, yeah, correct. This is where we're talking next year.
Yes.
So, but we need kind of an idea of how we're going to handle this.
Sure.
So, okay. Alder Gisselman?
As long as we're talking finances, as you remember last year in the fall, a lot of the low-hanging budgetary items were dealt with. We took care of the easy ones. The rest of the list from last year included swimming pools and a lot of other services that the citizens of the city of Wausau expect. So is anticipating budgetary cuts like we did last year, expectations from managers and supervisors to reduce the budget, just just advising the city council and the citizens that there may be some more drastic cuts that the city council may have to be dealing with in the budgetary situation this year. So with that, I thank you.
Yeah. And you absolutely, you make an excellent point, because adding this adding this line item does bring a whole new dynamic into our budgetary discussion, and it will make some tough decisions. I think it seems like the citizens, the citizenry of the city has stated that shelter services are important. So that will have to be part of our budget discussion, among other funding sources. But to move this forward, do we have a motion from finance in order to accept the contract, or approve the contract for emergency shelter services? A motion from Tierney, a second?
I'll second.
Second from Henke. Any discussion from finance on that? Not hearing anything. All those in favor say aye. Aye.
Aye.
Opposed? Oh, and, okay, so it was, Alderman McEnany, did you, no? Yes or no?
For it.
Okay, so 4-1. Gesselman opposed. That motion carries.
I'll accept the same motion from Public Health and Safety. Is there a motion to recommend to the council that we move the contract forward as
I'll make the
written?
motion.
Motion from Larson. Is there a second? Second from Watson. Further discussion? Seeing none, members in favor signify by saying aye.
Aye.
Aye. Opposed?
No.
Record one opposed. This item then will move forward to tonight's council meeting. With that, I will entertain a motion from Public Health and Safety to adjourn. Motion from Watson, second. Second from Larson. Members in favor signify by saying aye.
Aye.
Aye. Public Health and Safety stands adjourned.
I'll accept the same, entertain the same motion for finance to adjourn.
Move to adjourn.
Motion from Tierney, second from Henke. All those in favor say aye.
Aye.
We are adjourned. The finance is adjourned. Thanks. Council will start in a few minutes, as soon as they can get everything reset.